Hi, I'm Matt Valosen. I'm an orthopedic surgeon at the Bone and Joint Institute of South Georgia, and today I would like to discuss with you OrthoBiologics. OrthoBiologics are a constellation of treatments that we can utilize the patient's own reparative systems, mainly the platelets and the growth factors inside of them. We can take them, concentrate them, inject them back into an area of injury or degenerative type joints to help the patients to get some symptom relief. Why would patients choose OrthoBiologics? This is basically a different option that is non-operative for patients that want to try to heal acute type injuries, sprains and strains, chronic type injuries, sprains and strains that just will not heal over a long period of time, and newer type indications like arthritis, degenerative joint disease that can give them symptom relief without a surgery. The four types of injections that we offer are autologous concentrated plasma, platelet-rich plasma, bone marrow aspirate concentrate, and stem cells. The first type is autologous conditioned plasma, or ACP. This is probably the most common injection that we do. Basically what we do is we take the patient's own blood, we centrifuge it down, get the concentrate of the platelets and the growth factors, and inject it back into the area of injury. The second type of injection that we do is probably the most popular as far as recognition, and that is PRP, or platelet-rich plasma. This is along the lines of autologous conditioned plasma, but about 10 times more concentrated, so there are more platelets and more growth factors to get into the area of injury. The third type is bone marrow aspirate concentrate. We do not use the blood in this type of injection. We are using the patient's bone marrow. And the difference in that is that we can obtain the patient's stem cells. These are the types of cells that can differentiate into any type of tissue that the patient has, and helps to add another aspect of healing to that patient's injury pattern. The last type of injection that we offer are stem cells from a donor type patient. These are indicated in patients that may not have a high enough number of stem cells themselves, where we would need to get more viable stem cells to be able to accurately and appropriately treat the patient's injury pattern. One of the reasons that patients are coming to me and asking for these injections now is that it's not a secret. These types of injections are getting acute injuries healed quicker. They're getting chronic injuries that patients have had for a long time and giving them a viable option besides surgery to get these chronic problems to be resolved. And then, like I had said previously, the newer type of indication is for the arthritic patient. This is a new type of treatment that can be used as another option before we have to go on to big surgeries like joint replacements. My personal experience with OrthoBiologics started off in 2009. I'm a Pittsburgh Steelers fan, and in the AFC Championship game, Hines Ward sustained an MCL sprain to his knee. That's typically a 6-week injury without being able to return to the field, so I figured he wasn't going to play in the Super Bowl. Well, he got a PRP injection, was better in 2 weeks, and became the Super Bowl MVP. So at that point, I was like, this has got to be something that works. I started to research it a little bit more, started to use it in the military population on my soldiers whenever I was in the Army, and saw some very good anecdotal type responses to these patients that I was using them on. They were getting back to their active state a lot quicker. Injuries that were typically taking longer to heal before the introduction of OrthoBiologics were now getting better quicker. The chronic type injuries, the patellar tendonitis, the tennis elbows, the Achilles inflammation, was getting better with this PRP type treatment. I was able to utilize that into my civilian practice when I was done with the Army, into the types of patients that I see every day, the high school athletes, the weekend warriors, and the senior citizens that are doing everything that the younger population is doing. They're just not ready to have surgery, and this gives another option to try to avoid surgery. With this type of innovative procedure, there is some decision making to be done. So if patients are interested, they just need to call the office, get in with one of the surgeons, and we can walk you through which type of injection and which type of therapy is best for you.